World Immunization Week, celebrated in the last week of April, aims to promote the life-saving power of immunization to protect people from preventable diseases. Vaccines are one of the humanity's greatest achievements since 1974. 154 million lives have been saved through vaccines. That is more than 3 million lives a year, or 6 people every minute for 5 decades. More lives are now being saved among people of all ages with recent vaccines against malaria, HPV, cholera, dengue, meningitis, Ebola, and Mpox, reflecting an era of development and delivery. As 2025 is the midpoint in the Immunization Agenda 2030, Immunization Week will look at not only what immunization does to improve lives today, but looking at it, what have we been able to achieve, or what has been achieved in the coming year? Now, looking at this year's theme, the theme says, immunization for all is humanly possible. How does this theme resonate with us in Nigeria? Thanks for joining us on Nigeria Today. I am Eucharia Clinton. Now, joining me in the studio for this conversation is Dr. Isaac Akuma Eboja. He's a public health specialist. It's a pleasure to have you in Nigeria Today.
Good evening. My pleasure to be here.
I know quite a lot have been said during the introduction, but can you explain to us how immunization works and why it is vital, for public health?
Okay. Now, when we talk of immunization, we talk of the process of providing vaccines that prevent certain diseases in certain population. When we talk of vaccine coverage, we are talking of the process of giving vaccines to particular individuals of a particular age cohort, for example, against a particular or a group of diseases. And the way it works is that vaccines normally are of different types. There are some that are refrigerated, and even those that are refrigerated under certain temperatures. Some must be frozen, and they are transported in the same manner from wherever they are stored to the point where they are given. Now, when a vaccine is given to the person that is targeted, who is supposed to be prevented from being infected by a particular disease, it is done with the purpose of preventing that person from catching the disease. And how does this happen? Usually, the organism that causes a particular disease is the one that is used, destroyed, attenuated, and then given back to the person, so that when that organism that is no more functional, no more active, is given to the person, the antigens, the antibodies in the person's body, who are the soldiers in the blood of the person, will now rise and recognize, this person is an enemy, we must get him. So they come to fight the enemy. This is how vaccines work. So it is the organism causing the disease, in most cases, that is attenuated or altered, destroyed, and given back to the person that is receiving the vaccine, so that the antibodies in the person's body will recognize it as the enemy and come out to fight it. And by doing so, the person now becomes immunized. In other words, when the attack is done, and they now recognize that this person is the enemy, and they have come for it, and they find that you find that it is already dead. But what is the benefit of it? The benefit of it is that the introduction of that particular organism into the body of the person receiving the vaccine alerts the body's soldiers called antibodies. So they are ready to fight the disease. And by so doing, the person is protected. So even if the person now comes in contact with an active organism, the same organism that is now active, not the one that you give in the vaccine, the soldiers will now come and attack it.
So I will have to stop you here, Dr. Igboja, so that we now have here in the studio to join in the conversation is Christian Munduate, is a UNICEF Nigeria country representative. You're welcome to Nigeria today.
Thank you so much. Thank you for the invitation.
Thank you. So, Christian, it is 2025 Immunization Week, and UNICEF is one of the key drivers of this week. Now, can you enlighten us more, to give us an insight into what this Immunization Week is all about?
Well, first of all, of course, it's about making an additional effort beyond the existing permanent health services that at the primary health care level, they provide attention to children under 1 year to receive all their vaccines. But during the weeks of immunization, there is an extra effort of awareness raising, of informing people the importance of having their children immunized. They go more closer to the communities where the immunization people offer the vaccines. It is also a time where in the entire country there are efforts to communicate about the importance of being immunized. The doctor has already explained why it is important to get the vaccines. Many of the deaths of the children under 1 year and under 5 years can be prevented, and they can be prevented if the child is vaccinated. So this is the importance of having an knowledge and also a responsibility at the family level with the parents, that they should know that if they give the opportunity to their child to be immunized, they are guaranteeing their health and their life, which is more important, right? I must say that this is a joint effort that happens during the year, led by the government of Nigeria, both at federal level, but also at states level, where all the health system comes together and work for these immunization weeks. UNICEF, for example, the World Health Organization is one of the other United Nations agencies. We both come together to support the government efforts, but as well we have private sector foundations that also come in and support. Internationally, Gavi, the Gavi Alliance, helps and supports the country in terms of accessibility of different types of vaccines,
okay, let me get
among others.
Okay, thank you. Now, you just said this week is just for the, creating awareness about what
an immunization.
Okay, there's also an immunization going
yes.
on. So, what kind of immunization is going on now?
Right now, the children can receive vaccines against measles, against diphtheria. Also, there's availability for cholera. Children can also receive polio vaccines as well. So the whole effort of this week is not only providing one type of vaccine, is making available the spectrum of vaccines, all the number of vaccines that the children should receive. But because there is at times, not too many people from community or from cities go to the health centers. So the immunization campaigns is an effort to bring the vaccines closer to where the communities are. In an ideal situation, people should go to the health centers to receive the immunization, because the point is we cannot rely only on the immunization weeks. And of course there are limitations like distance, security, transportation that prevent many families to take their children to the service. But one important call that I make to all families and to all parents and to all communities: if you are close to a health center, if you can reach a health center, please don't wait for the immunization vaccines. Take your child to a regular health service so that they can have all their vaccines at the proper time.
Oh, okay, thank you very much, Christian. Now, back to you, Dr. Egbuja. I know Christian had mentioned, quite a lot of what is going on. Now, in your own opinion, how can individuals and families participate in this immunization week? Because we've seen situations where, some, especially from the rural areas, people feel that these immunizations are harmful. There are a lot of misinformation and disinformation about this, these vaccines. How can they participate, and how can they, be made to understand that these vaccines is for their own good?
What we're doing now is part of it. Creating awareness, health education. When mothers go for antenatal services, health education is given to them. When they give birth to babies, they are encouraged to go with the babies to the health centers and get the babies immunized. One of the points the country rep, UNICEF country rep, just made is the fact that while families are encouraged to go to health centers, closest health centers for routine immunization, this is not always possible. But it should be made clear that the best way to sustain immunization is for us to continue to go for routine immunization. That cannot be underestimated. You must always emphasize on routine immunization. The awareness that is being created this week, for example, is to increase the level of immunization activities and to increase the number of children who, before now, have not had access to immunization. Physical access in particular. There are some babies that are born in rural areas where the mothers did not even go to any clinic for antenatal services, and therefore the babies did not receive any immunization. This is the time to create awareness. This is very key, so that there's an understanding, and also to clarify certain misinformation being given. There have been some times in the past in this country when information had been given wrongly about vaccines. For example, polio vaccine. Some years back, it was a lie was spreaded all over the country that it was harmful, whereas that is not true. Nobody, no government, no organization, no doctor, no health worker would give anything that is harmful to a patient. That will never happen. But that happened. The misinformation happened. And people were discouraged from coming to the health center. It took a lot of time. Many traditional rulers were visited and invited, and they were encouraged to talk to their people in their domains. And that happened before people regained confidence in immunization program. Therefore, the low level of awareness has to be worked on so that there's more awareness. There should be more social mobilization. There should be more information dissemination in different languages that people can understand.
Okay, now back to you, Christian. Talk to us. Are there new vaccines that have been introduced into the shuttle? That's one. Now, secondly, in the course of the, going for the immunization, have you encountered, what are some of the barriers that you've encountered, and how were you able to handle them?
Well, to put examples on new vaccines, last year we received, and I say we because I feel Nigerian, the country received quite a good number of vaccines against cholera, and it helped a lot some of the states in the north to control some of the outbreaks that they were there in relation to cholera. We also have the vaccines that prevents papilloma, which is really important, mainly for women who are in reproductive age. So this is a prevention not only of the infection, but at the end, a prevention of cervix cancer. So that is the importance of this type of vaccine. I would say that we are really making a serious call, and that is why it is called the week of awareness raising in terms of immunization, to make a call to those people who are providing misinformation against immunization of children, that they're really making huge harm in the children. I mean, the harm is such that many children are dying, practically dying, because they don't receive the vaccines. So I think there is a moral obligation and also a citizen's obligation not to spread these misleading messages, because at the end of the day, the consequence is death. So this is the type of negative impact that this has, and we count on different types of leaders and sectors, not only national or at state level. It has to go very granular at the community level, so that people can understand the message that these do no harm. This provides health and provides life.
Thank you very much. We'll take a short break now. The conversation will continue after the break. Don't go away.
Of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow, under digital economy, for banks not to be dispensing domestic currency in that economy.
What will make this one different? We want to know what they do as occupation. All of these are attributes that our questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today.
Welcome back. This is still Nigeria Today, and of course we're looking at the immunization week, and of course I have a UNICEF representative here in the studio and a public health specialist. Now, Dr. Egbuja, I know just like Christian had mentioned that there's quite a lot of activities going on, a lot of things that the government is doing to support this movement. But in your own, as a health specialist, what more do you think should be done if success rate should be, if we are expecting a higher success rate?
Well, one of the things that I mentioned earlier is health education. When we talk of health education, we mean passing information, key information about health generally, and about diseases that are vaccine preventable. And the reason why these vaccines are given against those diseases. That is very important. People need to know what these diseases are, what the vaccines are, and why they should be given the vaccine so that they will be protected against those diseases. Yes, At the community level, information should be shared. At the health center level, information should be given to patients who come for whatever service in a hospital. And at the country level, at the government level, information should also go out, especially through all channels like television, radio, whatever means, traditional means of passing information, so that people are aware that these services are available for those who don't know, and for those who know and have some doubt, so that their doubts can be cleared. It is very important for everybody to believe and to have confidence that when they go to the health center, there will be somebody with vaccines that would administer those vaccines to them. And that when they go once, for example, that does not necessarily mean that they are yet, that they have been fully protected. I need to emphasize that. There are some vaccines, for example, against tuberculosis, against pertussis, against diphtheria, against measles, that you have to go for more than once. When a child is born, he is given PCG, which is against tuberculosis. That is the first dose. After 4 weeks, that child has to go back again. After another 4 weeks, that child has to go back again. When that child grows up to the age of 9 months, the mother has to take that child back for measles. So if you take some vaccines or some doses of the vaccines, and not all, you are not fully protected. It is important for people to know that just going to take one vaccine or one dose of a particular vaccine does not protect you. You have to go for all,
Okay.
as is recommended.
Okay, now back to you, Christian. How safe, because that's been the concerns of some persons, uneducated people mostly, how safe are these vaccines? And what should a parent know before vaccinating their children?
Well, vaccines are completely safe. You know, in very few occasions, the child might get immunized and have a little bit of fever, but that is not really a big problem, right? I think that if the concern of the parent is about how safe is the vaccine, then the message should be how unsafe and how much are you risking your child's life if you don't grant them the opportunity to receive the vaccine. And this is what needs to be understood, that if the child doesn't get immunized, there might be high risk of having the disease, and at times with very fatal consequences, because they simply die. And the reason why we still have a sort of high number of deaths on children is because they are not immunized. The country still has more or less, Doctor, 2 million children that have not received a vaccine. You know, what if there's a widespread of one of these fatal diseases? Basically, they will be having it with no option, no exception. They will get sick.
Okay, let me ask you, quickly, is there malaria vaccine?
Malaria vaccine is something that is in the trials. There are efforts to bring a lot of vaccines. The point is because the production is still in low volume, of course the cost of the production is high. But I remember I had a meeting in one of the Delta states. I think it was with Bayelsa, with the deputy governor of Bayelsa, and we were talking about the need of routine immunization and primary health care, and he said, Christian, what we need is vaccines for typhoid, vaccines for malaria
I'll have to stop you
because
there,
our
Christian.
people are dying.
I have to stop you here, Christian. I really wish we had more time because I had quite a lot of questions to ask. You know, but then this is where we wrap it up on the program, Nigeria Today. A very big thank you to Christian Munduate, the UNICEF Nigeria country representative. Thank you so much for coming on the program. And we also had Dr. Isaac Akuma Egbuja, he's a public health specialist. Thank you so much, Doctor.
My pleasure to be here.
And thank you for being part of the program. I am Eucharia Clinton. Goodbye.
Thank you.